welcome back for another week of tips with me in the nursing studio. For those of you who are new to me, I am Dr. Brittany Weinstock, family nurse practitioner and founder and CEO of the nursing studio. But this week, let's get into hypothyroidism versus hyperthyroidism. Okay, so follow me while we talk a little bit about it. Okay, so hypothyroidism. There's three labs that we really want to focus in on when we're diagnosing someone with thyroidism. We want to look at your TSH, your T3, and your T4. Now, hypo, we know in med terminology, hypo means low, right? So with hypothyroidism, the TSH is going to be the opposite of what you would think. The TSH is going to be elevated, but your T3 and T4 will be low, just like the terminology suggests, right? Now, that's the primary hypothyroidism. With subclinical hypothyroidism, the TSH will still be elevated, but the T3 and T4 will be normal. And I tell people to think of it almost like pre-diabetes or pre-hypertension, getting us to know that this person, has hypothyroidism and it is advancing. So once you know this and are able to identify and to diagnose them, then you need to know how to treat them, right? So if that TSH gets to 10 or greater, that's when we start to initiate medication therapy. So you want to start with Synthroid. You want to start with that 25 micrograms, and then you have them to follow up every 6 to 8 weeks to kind of see where their lab values are, seeing if you need to make any adjustments or not, okay? All right, follow me so we can talk about hyperthyroidism. Before we move on to hyperthyroidism, let me also add in Hashimoto's disease is the autoimmune disease from associated with hypothyroidism. So if the thyroidism is left untreated, they can have this autoimmune disease called Hashimoto's, where their symptoms are more exacerbated. So when you think about hypothyroidism, I think low, like things are low, moving slow, they have weight gain, they're depressed, things of that nature. Heart rate is low, bradycardia. So Hashimoto's has this a little bit more exacerbated, okay? And remember, we talked about Synthroid as the treatment, but make sure that you tell your patients to take this medication on an empty stomach, as it has a lot of interactions, okay? All right, now on to hyperthyroidism. So with hyperthyroidism, just as I told you with hypo, the TSH is low because it's the opposite, right? And then the T3 and T4 are elevated. But with the subclinical, the TSH is still low, but the T3 and T4 are normal. Same scenario, right? Now with this one, the associated condition is Graves' disease. Where they'll have the exophthalmos with the eyes bulging, and they can also get into an emergent case, which is called thyroid storm, and they may have hypertension, fever, and all those things, but again, that's an emergent case, so they need to be transferred to the ER, okay? But with hyperthyroidism, they may present, and that's the one I always talk about. It's like they're racing. Think of someone who is hyper. So they're running. So their heart rate is elevated. They're sweating. And I always say, because they sweat so much, it makes their hair brittle. So that's how I think of hyperthyroidism. And they have weight loss also. So I say, just think about it. You're just burning up all those calories, running, because you're hyper. That's the way. That's my Brittany's brilliance on that. But with hyperthyroidism, treatment options that you have is PTU, propranolol, radioactive iodine, or they may get ablations as well. Okay, so this is just a short and sweet tidbit tips for this week, hypothyroidism versus hyperthyroidism. If you have any topics or anything that you may want me to cover, questions, or if you need me to elaborate more in this area, make sure you like, comment, share, and subscribe so that you don't miss out on any of the videos that I do on here. We'll have, we do tips every week. I should say most weeks. We'll have more rolling out, and every week we have our Work It Out Wednesday question with the answer on here. So be sure that you share it with friends if you feel like they'll find this beneficial. Post it in your groups and things if you can help your classmates as y'all are preparing for boards or other graduates. But meet me back here next week for more tips.